The Afar people are one of the last pastoralists in the world. They live in the Horn of Africa, over 3 countries, Eritrea, Djibouti and Ethiopia, the majority in Ethiopia. And of the Afar, 85% are pastoralists, moving with their herds to find water and pasture. The land they live in is pretty dry, pretty hot. In fact, the hottest inhabited place on earth. And they are living more or less a traditional lifestyle, a lifestyle governed by their own laws, their own beliefs, and set into the ecology of the land. So they are living so that their environment can be preserved. Afar Pastoralist Development Association is the community's own organisation. It started within the community, it remains in the community, and it's governed by the community. And so in the whole, in much of development work, it's unique in that respect. Everybody in the organisation is Afar aside from me. I'm in it because my husband's Afar, and I was one of the people who started this organisation in 1993. There were 34 of us together who sat down to see that the Afar were people without any form of development, whether health, whether education, or any form of development. So what to do? We set out a very, very simple program in the first place, and that's developed now from very tiny beginnings and totally on a voluntary basis to an organisation of 700 Afar who are all development workers of one type or another from the community they live in. And that's what is APDA. APDA is the pastoralists trained to be health workers, teachers, women extension workers, and we are utilising the community's traditional birth attendants. Well, for the Afar, childbirth is the most dangerous thing because they are without health services, without anything such as a clinic or a professional person, health person near them, aside from our organisation. Well, we've started a base level, a primary health program. So the health workers are from the community that they're working with, and these health workers go on their feet, house to house, checking everybody, including pregnant women. And now we've taught the health workers and their partners, women extension workers, who are women without medicines, but women raising awareness, women working with women and empowering other women. So these two go together to do antenatal checking of all pregnant women, and they know the women, the mothers at risk. And so that we classify 9 classifications of mothers at risk. Those ones have got to be referred no later than the last month of pregnancy to a clinic or a hospital for delivery. So we're doing that to try and lower maternal death. We're training traditional birth attendants in the community. Till now we've trained over 600 traditional birth attendants, and each of those traditional birth attendants is networked to our program, given equipment, so they're working as they can to do a clean delivery, at the same time referring mothers who are going to have difficulty in labour. So we're working through that, and we're working with the government also. So we're referring to government clinics, government health posts, and slowly the maternal death is going down. From the training that we're about to do through the Birth Kits Foundation of Australia, there will be 50 women traditional birth attendants who will be equipped, will be firstly trained, equipped, and they will be networked to our program. And we'll be working in areas where there are no trained traditional birth attendants till this time. And just recently, I went to one of those areas, and just 2 days before I reached one place, a young girl, 16, died in childbirth. She was obviously delivering her first baby. She was 4 days in labour, She was absolutely exhausted, poor thing, and eventually they got, the baby died in utero, they got the baby out, and just soon after the birth she collapsed and died. Well, to my knowledge, they're funding a very vast program. They're funding programs in Vietnam, in many countries, in Africa also, in the Congo and other countries in Africa, as well as in Ethiopia. And this is providing 95,000 birth kits a year, which is an incredible achievement. This means that 95,000 deliveries are being done each year through this organisation in a clean and safe manner, because before they get the birth kits, all these traditional birth attendants are trained. Training and distributing these kits really is the key to promoting gender equality, because at the moment these traditional birth attendants are just really taken for granted as the woman just to be called when the baby's head is coming and to let that baby out. So once she's trained, she's a woman of knowledge, she's a woman of capability. In her hand is the equipment to make a clean delivery, a safe delivery. And so she is now a woman of much higher importance in the community. The community can see that, knowledge is needed to deliver a baby and to give assistance to this mother during pregnancy. And also equipment is utterly needed. You must have soap, you must have a clean area, you must have clean cord ties and so on. So all this is vital, and so it is it's making the whole thing practical. Well, the birthing kits are the instrument of doing those two MDGs as well, of lowering infant mortality and lowering and reducing maternal mortality, because without it you're going to have huge problems, and we do have them. We have huge problems of infection. The woman is delivering on an uncleaned area in the first place. The newborn baby is put onto that unclean area. So the kit has got a sheet of plastic which is clean. The kit has got soap. The kit has got a clean blade to cut the baby's cord. And so through that, the baby's not going to get tetanus. Neonatal tetanus is a very big killer in newborn babies. And aside from that, all the other material is clean. It's not sterile, it's clean. And so we're stopping or lowering these infections for both mother and baby, and we are putting them through a system which means the whole system's related to the training, and this training is being used in the delivery, and so the delivery is being done from a better perspective, from a perspective of knowledge and awareness, and this is also helping to lower the maternal death and infant death. Yeah. The kits actually do help to lower contracting HIV and AIDS, because anybody's blood could have the virus in it of HIV. So if the traditional birth attendant wears gloves, then she won't touch the mother's blood, so she's not going to get it in the first place. And so it's a big help in that respect. A lot of people do contract by direct blood contact. It's only by wet blood contact, and you've just got to have a tiny cut on your finger to get it. We started making birthing kits when we started training traditional birth attendants, because there's no point in training. It's good to train them, but you can't train a person and give them no equipment to do the job. We're telling them clean births. We're telling them hygiene and sanitation and so on. And so we have to provide them with a clean razor blade, a clean cord ties, and an undersheet for them to lie on and so on, to make the delivery clean. And so we started producing them at the time we started training them, which was roughly 1999, 1998, we started the first traditional birth attendant training. And now we try to make enough for every single delivery, which we've got to keep we've got to keep a big production going. Because we would be assisting maybe up to 10,000 births every year. Well, our birthing kits go out to all our trained traditional birth attendants. We're working in, as I say, around about 40% of the Afar region. The region's divided into 32 administrative districts. We work in 18 of these. In each of the districts, we're not in every single community. We'd like to be, but we haven't got the resources. And so in each community, a community of say 5,000 people, we try to train 5 traditional birth attendants. But I don't think we're covering exactly that.